Bella Society. Now today on the show we're talking about how we can obtain flawless skin just in time for Raya. And just then we talked about a very common skin condition. It's called skin tags. And now we're going to talk about another common skin condition that we all possibly, we probably have our own pimples one time in our lives, or if you're lucky, one time, but if you're not, then for a very long period of time. Yes, we're talking about acne and pimples, and we have Dr. Peter Chung Wee Beng, who's a consultant dermatologist from Tropicana Medical Center, here with us to talk about pimples. So welcome on the show, doctor. So let's talk about acne or pimples. How are they formed?
Okay, right. In the normal skin, we have hair follicles.
Okay.
And connected to the hair follicles, there will be oil gland.
Okay.
So
what are these oil glands for, actually?
It's actually to moisturize our skin.
Okay.
So once they produce the oil is transported through the hair follicles to the surface of the skin. At the same time, at the surface of the hair follicles, there will be dead skins. They'll be shed off periodically.
Okay.
Yeah. So in a patient with acne, the number one problem is the oil gland is overproducing the oil. At the same time, there is also impairment of the shedding of the dead skin.
I see.
So the oil gets blocked in the hair follicles. That is why you see the black pores and the white pores, right? So when the oil gland gets too bulky, it ruptures and it will cause inflammation. At the same time, these patients also have a bacteria we call P. acne.
Okay.
Yeah, so there will be increase in this bacteria that cause even more inflammation.
Are the bacteria naturally occurring, or it's from outside sources?
It is natural,
Okay.
but at some point it gets active, overactive, it gets inflamed and increase in numbers. That's what make acne happen.
Okay.
Yeah.
All right.
So this is how
So
acne
when
is
the
formed.
oil and the bacteria comes
Correct.
together in the surface of the skin,
Right.
that's when it erupts. And
Right, and when it gets inflamed, that's where you get your red bumps, your fluid-filled cavity.
Okay. All right. But some people say, I have really dry skin, and there's rarely any bit of oil on my skin, and yet I still get pimples. So how is that possible?
Yeah, because pimples happen frequently on the face, on the chest, at the back of your trunk. So these are the acne-prone areas. But at some point, at some other areas can be dry as well. So we can have two things in a person. You can have eczema in one place and acne in the other place.
Oh, okay.
Yeah.
So it doesn't matter whether your skin is dry or you think it lacks oil.
It doesn't
oil
matter.
will still be produced.
And also because there are, as I mentioned just now, there are 4 pathogenesis, 4 reasons why acne occur.
Okay.
So for some patients, it is not only the overproduction of the oil gland, but it's just the blocking of the pores. That's why you get the black pores, the white pores.
Okay. So are there a lot of different types of acne, or is it just acne? It's just pimples?
Yeah, there are mainly 2 types. One is we call it non-inflammatory, and one is the inflammatory type. The non-inflammatory will be your blackheads, your whiteheads, whereas the inflammatory ones will be your red bumps. You can have pus-filled cavity. You can have a larger bumps and also a fluid-filled cavity. We call it a nodulocystic acne.
Okay. What does that mean?
Nodules just means a big bumps. Cystic means a fluid-filled cavity inside.
So sometimes you have a big bump with no white pus, but it will be there for a long time. Is
Correct.
that also considered a pimple?
Yeah,
Or some people call it a pile as well, is it? No?
Not pile, but just we call it nodules.
Okay.
It's just inflammation inside, lots of inflammatory cells inside.
Okay. And there's nothing that you can press?
No. For that, you cannot press out.
Okay.
Yeah.
All right. We all know that, both men and women have acne. Is there a gender that has more than the other? Or is there an age group? Of course, we say teenagers, they have more acne.
Correct.
Why is that?
Yeah. Men and women are equally affected.
Okay.
Although men tends to be more severe, tends to have more severe acne because they are more prone to getting nodulocystic acne, which is a more severe form of acne.
Why is that so?
Why? Because nodulocystic is, as I mentioned, big bumps,
Okay.
and also it's fluid-filled cavity, so it's deeper inside. So the chances of causing scarring is higher.
But why do men get more of these nodules?
Nobody knows exactly why.
It's not a hormone thing,
Yeah.
or maybe because men do not wash their faces
No.
often.
Or they present late, right?
Okay,
No, but
yeah.
somehow, even if they present early also, they come with nodulocystic acne.
Okay, then why do we, link teenage years with pimples?
From the statistics, we know that from age 13 to 18 or 13 to 19, that's the age where you have a higher risk of getting acne, mainly because of the changes in hormone. Right? But acne can also happen in adults.
Yes.
And about 50% will continue on into adulthood, actually. Yeah.
Okay, so what are are there anything that we can do at home to prevent acne?
Yeah, you can, basic things like cleansing your face, right, 2 times a day, and don't squeeze the pimple, avoid scrubbing, avoid products such as makeups that can block the pores.
Okay.
That
So
is
no
oily.
scrubbing, but you're saying that it's because of the dry skin or
Correct.
the
oiliness.
the dead skin that
Right.
hasn't come off that makes the pimple pops
Right.
up.
Yeah.
So we shouldn't scrub it.
You shouldn't, because scrubbing, you will damage the surface of the skin.
Okay.
And it's rough. The scrub is rough. Well, we can do chemical peels,
Okay.
mild chemical peels to remove the dead cells, but not scrubbing.
Oh, okay. How about popping it? Because
Yeah.
that's what we all do at home when we see a pimple. That's all we want to do is just
Yeah.
to pop it.
Yeah, because once you pop it, first of all, your hands may not be clean, so you may introduce bacteria into the bumps. And secondly, when you squeeze it, there's no exit point because it's blocked. So you can actually damage the inner skin more and cause further scarring.
Okay.
Yeah.
We actually have a caller from Taiping, Raymond. Hello. Good morning.
Hello, good morning.
Morning.
Okay, I want to know about because of my pimples. Okay, now my age is 26 years old. I want to know about my
26 is not old, Raymond.
Okay, I want to know about my pimples is because it's a skin problem or the blood problem.
It's a what problem or blood problem? Sorry.
He said that about my pimples. I see the doctor from the doctor's suggestion. He said that my one is because I'm eating too hot. I have the pimples, you know.
Oh, okay.
So that is a blood problem or the skin problem.
Okay, all right. I will try and answer your question.
Okay, thank you.
Thank you, Raymond, for the call. So, can things that we eat cause pimples as well? I think that's what Raymond is trying to say. The doctor is saying that he's eating too heaty stuff.
Yeah.
That's very Chinese, it's very traditional. Like if you eat a lot of heaty stuff, then you get pimples.
Yeah. There are a few studies that look at diet influencing acne.
Okay.
And some studies showed that those with low glycemic index and a high fiber diet, meaning, for example, low glycemic index like your vegetables, your beans, and those diet will tend to have less acne.
Low glycemic, would that mean low sugar as well?
Low sugar,
yeah?
correct. Low sugar, that means high sugar being things like white rice, your white bread, all this.
And those might cause pimples?
Cause pimples, and also a high dairy products might cause pimples.
Oh, okay. So what you eat will also actually cause pimples to erupt.
But most importantly, it is not a monotherapy, meaning if you just change your diet, your pimples is not going to go away.
Oh, really?
Yeah.
But if the pimple is caused by diet, it will never just be caused by diet.
It will not just be caused by diet.
Okay, so when do we know that it is serious and we cannot treat it just at home and we need to go consult a dermatologist?
Yeah, actually, when a patient comes to us for any facial rash, first of all, we have to make sure that the diagnosis is correct. Because acne can be confused with other skin diseases. Because a lot of people think that rash on the face is acne, but it doesn't equal to acne.
Okay.
We have other diseases like rosacea, gram-negative folliculitis, all these diseases that can mimic.
That looks like pimples, but there aren't pimples.
Correct.
Okay.
So first of all, getting the diagnosis correct. This is very important. Then we also need to rule out any secondary cause of the acne. For example, certain hormonal disease like polycystic ovarian syndrome among women. Those can cause acne as well. Medications such as steroid, anti-tuberculosis can also cause acne. Because I have many patients who go to gym, take supplements, so-called protein. Those can actually cause acne as well. Yeah.
Wow, okay.
And then we look at environmental factor as well, because things like very oily environment. I have patients who work as chef. They can get an oily environment. The products that they use, if it's too moisturizing to your skin, can block the pores. And some hairstyle also. If you see, a lot of guys, if they block the forehead with their hair,
Okay.
Because the hair is also oily, so it blocks the pores. So acne tends to happen on the forehead.
Hairstyles as well. Okay.
Yeah.
We actually have another caller on the line, Jess from KL. Good morning.
Hello.
Morning.
Morning.
How are you?
Morning.
Fine, good, thank you.
Do you have a question for doctor? Yeah?
Yeah. I was just to ask, because my wife, she have a dry skin,
Okay.
so I tried to get some few medicine and things, but cannot be worked.
Okay.
So all the body, each pimple she comes to the body.
So she has pimples
over there.
She has pimples all over her body?
Yes.
Yeah?
Yes. Yeah. Especially in the hand and in the leg.
Okay. In the hand and in the leg.
Yeah.
Do you have any questions for Jess?
Is it dry
only
skin?
that.
Dry skin or pimples?
Hello, Jess?
The problem her skin is dry.
Dry skin. So
Okay.
it's not exactly pimples, are they?
Yeah. There are few pimples there. Yeah.
Okay. All right. And your question is, what can she use, or?
Yeah. What can she use? Yeah.
Okay. All right. Thank you so much for that question, Jess. So I think, from what I hear from you, she should go see a dermatologist first to diagnose what is actually wrong with her, right?
Exactly. Yeah. Because there are a lot different long list of diagnoses of dry skin. And I normally the most common dry skin cause of dry skin is eczema. And for eczema, I will need about 15 to 20 minutes to look at her routine and whether it's a genetic condition to determine what kind of management to treat. So it's difficult to
But eczema, if that's eczema, they have pimples growing out of eczemas as well? No, right?
Yeah, no.
Okay.
They don't.
So it might be a different condition.
But you'll be surprised that patients who have acne, they do present to us with eczema as well, simply because of the product that they use.
So
they
use the
thought
wrong
they have
products.
acne, then they apply some other products, then they have eczema on top of the acne.
Okay. So what are actually some of the treatments that dermatologists will give to a chronic acne sufferer?
Right. So treatment that we have includes topical treatment like benzoyl peroxide, retinoids, topical antibiotics. Whereas oral, we have antibiotics, hormonal therapy, and isotretinoin, which can only be prescribed by a dermatologist.
Okay.
But treatment should be individualized according to the patient, because we base on types of the acne and also severity of the acne. You'll be surprised. I have patients who works as models, air stewardess. They come to me with just 1 or 2 bumps on their face, but to them it's so severe,
Yes.
because
For me too. If we have to be in front of the camera and we have a big bump on our face, it's really just unsightly.
Right.
Is there a quick fix actually for one bump?
quick fix, meaning within a week.
Within
Within
night.
a day, night. No.
So if let's say I have a bump tonight and then tomorrow I have to be live on the show, I can't come to you and say, doctor, can you help fix this bump?
Well, it depends. If it's a fluid-filled cavity, we can always aspirate it and inject some steroids in it to reduce down the inflammation.
Okay.
Just on that side, not to the system.
Okay, all right.
Yeah. So, but on the other hand, there's also a patient recently also, a young teenage boy who was dragged by his mom to see me. Very bad acne from physically, but he told me, hey doc, I'm a man, I'm a man. Acne is not a problem to me.
Okay.
So I have to tell the mom now, I cannot force treatment onto him, but I explain to him what are the consequences.
Yeah.
You may get scar, you may not be able to get a girlfriend next time. Then he started his treatment, and now he's on frequent follow-up with me.
Okay.
Coming by himself.
Okay.
Yeah.
Okay, any last words, doctor, for all those acne sufferers out there? What should they do? How, when, or why should they come and see a dermatologist? Yeah.
Because acne is actually a very easily treatable disease. So if you have acne, seek treatment early. Right? Don't wait until you have scars. Don't wait until it impacts your quality of life. Right? And it's easier to treat acne than to treat the scar.
Okay.
Right.
All right. Well, thank you very much, Doctor,
Thank you,
for
Belinda.
sharing an insight into pimples and acne. So remember, if, like Doctor said, get it treated early because it's much easier to treat pimples than to treat the scar that's caused by pimples. So thank you so much,
Thank you,
Doctor,
Belinda.
again for being on the show. Now we're going to go for another quick break. But when we come